you doing? My name is Alex. I'm going to be the PA student taking care of you today. Can you just confirm your name and date of birth?
Timothy Gray, February 3rd, 2000.
Perfect. So, Timothy, I just want to conduct a neurological exam on you today. Can you just tell me where you are today?
At the clinic.
Perfect. Do you know today's date?
December 5th, 2024.
Great. And do you know the current president?
Joe Biden.
Perfect. So now we can say that the patient is alert and oriented ×3. And we're going to test for recent memory. And if it was verifiable, we can test remote memory. However, that's not currently possible. So with the recent memory, we'll give him 3 words, have him remember it in about 5 minutes, and then we'll ask him to repeat those words back to us, all right? So the 3 words I want you to remember are going to be boy, girl, and basketball, okay?
Got it.
Perfect. So I just want you to, we're going to assess his concentration and attention as well. So I want you to spell world backwards for me.
DLROW.
Perfect. And so we're going to count backwards from 100 in intervals of 7. Can you do that for me?
100, 93, 86, 79, 72, 65.
Perfect. We're good right there. So we can say that his attention and concentration were perfectly normal, and we can continue with our neurological exam. Oh, you tell me, sorry.
3? Yeah, it's already rolling.
Okay. So now we're going to continue our neurological exam by assessing each of the cranial nerves. We'll start with the first one being the olfactory nerve. However, we don't have anything to differentiate certain scents, so we're going to simulate it, say that this smells like coffee, and we'll tell our patient as well to occlude one nostril and to differentiate the different smells, all right? So Tim, can you just occlude your left nostril for me? Your left. Thank you. Perfect. What does this smell like? I'm sorry, close your eyes.
Coffee.
Perfect. Can you occlude your right one? Perfect. What does it smell like?
Coffee.
Perfect. So looks like his olfactory nerve is intact. Also, I would like to mention, ideally, we would want to have separate scents for the different nostrils as well. So to assess the second cranial nerve, which is going to be our optic nerve, we're going to test his visual acuity, visual fields, and we're also going to mention that traditionally in a neurological exam, we would do a fundoscopic exam, but we will be omitting that for this current instance. So Timothy, if you can I'm going to be 6 feet away from our patient, and I want you to read this bottom line for me right here.
LTFPH.
Perfect. Can you just close your left eye? Perfect. Just read it backwards for me.
HPFTL.
Perfect. Just switch over. Thank you. Can you read the 2 lines above?
EPTZO.
And now just this last line backwards.
HPFTL.
All right, perfect. The only reason I did that was so that we didn't encourage any rote memorization for our patient. We're also going to do visual field testing through confrontation. So if you would just want to stand up for me. So what we're going to do here is I'm going to cover my left, your right eye. Perfect. So we're going to be matched. I want you to tell me when you see my fingers, okay?
Okay.
Perfect.
Okay.
All right.
Okay.
Perfect. Yeah, sorry.
Okay. Okay. Okay.
All right, can you switch eyes? Thank you.
Okay. 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 Okay.
All right, perfect. All right, so it looks like his visual fields were intact as well. I messed it up, but we're not going to redo it. So the next cranial nerve that we're going to be assessing are going to be the cranial nerves 3, 4, and 6. These are going to be oculomotor, trochlear, and abducens, respectively. These are just going to check the different movements of the eye, check for his eyelids, make sure that they're symmetrical, there's no lid lag or nystagmus visible, the extraocular movements of the eye, and also ptosis, we mentioned that with the eyelid, and pupillary reactivity as well. So we're just going to quickly start off with the pupillary reactivity. Perfect. That was negative. And we're also going to just observe, make sure that his eyelids are not, there's no ptosis or anything like that. Everything looks about symmetrical. There's no abnormalities seen here. So Tim, if you want to do me a favor, I just want you to follow my finger, okay? Perfect. So we made the H in the air, and that's just basically how we assess for the extraocular movements and all these, the three nerves that we just mentioned as well. So now as we continue through the cranial nerve assessment, we're going to be checking the fifth cranial nerve being the trigeminal. We're going to just palpate the temporal mandibular joint, checking the masseter muscles, the temporal muscles. We're just checking for any palsies that could be present here. Then we're also going to be assessing the sensory nerves in these areas as well, where we're going to check with the sharp and dull points that I have, that I'll show you as we continue. And yeah, so we'll just continue through this exam. So I'm just going to ask you to, all right, right here, just clench your muscles. Perfect. Unclench and clench one more time. All right, so now we're just going to check for the sensory portion of this nerve. So Tim, I just want you to feel what dull feels like. This is dull. This is sharp. Okay? All right, so I'm going to go along his optic, his masseter, and his mandibular areas of his face, just to make sure that everything feels symmetrical, especially on both sides. All right, just tell me what this is. Is this sharp or dull?
Dull.
Perfect. What is this?
Sharp.
What is this?
Dull.
What is this?
Dull. Sharp. Dull.
Perfect. So completely negative. All his sensory portions of his trigeminal nerve were intact. So now as we continue through the exam, we're going to test cranial nerve 7, which is going to be our facial muscles. So Tim, I just want you to raise your eyebrows for me. Perfect. Close your eyes as tight as you can. Beautiful. And I also want you to smile like a grimace. Perfect. Looks good. Can you just puff your cheeks for me? Perfect. I'm also going to try to push out air. Let me know. Just perfect. That was negative. We were just checking for muscle tone there. So as we continue through our exam, we're going to assess the 8th cranial nerve, being the acoustic nerve. Tim, I just want you to push into your ear right here on the right side. Perfect. I'm going to whisper to you a word, and I want you to repeat it back to me, okay?
Zebra.
All right. Can you do the opposite ear on the other side?
Apple.
Perfect. So this was negative for any abnormalities in his ears. If it was positive, we would continue on with a Weber and Rene test, where we would check for bone conduction, any sensorineural abnormalities, which would be more relevant towards the neural exam. So now as we continue through the neurological exam, we're going to be assessing the next 2 cranial nerves, being 9 and 10. This is our glossopharyngeal and vagus nerves. Here we're going to be, as we've been through this entire exam, we've listened to Timothy speak to us, so there was no hoarseness. He had a linear thought. That was more mentation and his assessing his mental status. We are going to check his make sure his uvula is midline, and he has a bilateral soft palate rise. So if you can just open up your mouth for me, tilt your head up for me. Thank you. Can you say ah?
Ah.
Perfect. So that was a bilateral soft palate rise. Negative for any abnormalities there. And uvula was midline. And we would normally do a gag reflex, but for the sake of time and the lack of materials and for the purposes of this exam, we won't be doing that. Timothy, so I'm just going to test a few things here. I just want you to shrug your shoulders against resistance. So shrug, perfect. Muscle tone is symmetrical and pretty strong. I also want you to move your face to the left, perfect, and to the right. Equal strength bilaterally on his sternocleidomastoid muscles. And we'll also, that's fine. We're also going to be checking the hypoglossal. I want you to stick out your tongue for me. Little more. Perfect. I want you to move it to the left and to the right. Negative for any palsies. Negative for any fasciculations, deviations, or any asymmetry as well. So now, next we're going to perform the Romberg and pronator drift tests. We're just going to ask for our patient to stand still. Can you just do me a favor? Stand like that. Feet together. Hands on your side. I want you to close your eyes. We're going to be around our patient. We're going to wait about 30 seconds in order to make sure that he doesn't lose his balance or fall. And 30 seconds has passed. And we see that this was negative. All right? Now for pronator drift, I want you, Tim, to hold your hands out like this. Palms up. Perfect. He's also going to do this for another 30 seconds. If it was positive, it would his hands would turn like that to the prone position. But as we see, 30 seconds has passed and that was negative. Tim, also, question for you. Do you remember those 3 words that I gave you?
Boy, girl, basketball.
Perfect. All right, so Tim, we're gonna also test your cerebellar function. So I just want you to touch your nose like this. And then as I move every position, I want you to touch your nose, then touch my finger. And as I move, you're gonna touch your nose, touch my finger, okay? Go ahead. And you rub your heel all the way down to your toe of the opposite foot. Perfect, and exactly, we're gonna do both sides. So that was negative, the cerebellar function seems to be intact, and we can continue on with our exam. So now we're just gonna check for his rapid alternating movements, just to make sure that those are intact as well. Tim, if you can just do me a favor, I want you to have your hands like this, and quickly go like this. Perfect, those are intact. And can you just stand up for me? I wanna assess your gait, your walking ability. So we're gonna pass each other, and I just want you to walk normally, okay? Perfect. Now I want you to come back towards me. We're gonna do the same thing, and you are going to be on your heels, like a penguin walk, all right? And lastly, I'm gonna ask you to be on your tippy toes like this, and we're gonna do the same thing. Perfect. So now we're going to test our patient's neurological system based on his reflexes. So we'll start right here on his brachioradialis. Just relax your arm. Perfect. We're just going to. Perfect. And then right here we find the biceps tendon. I'm just going to ask you dead wing. I want you to just. Perfect. And now we're gonna find our patella, go right under. Beautiful. Now down here, we're going to test his Achilles reflex. Perfect, and Babinski. Perfect. So because his toes curled downward, that means that it was a negative Babinski sign, but if it was positive, they would curl up. Our patient's reflexes were 2 plus.
Cool.
So the next portion of our exam, we're going to be testing his sensory nerves. We're just going to be pretty much just having him close his eyes and determine if this is a pointy side or the dull side of our object. All right, so Tim, if you could just close your eyes, I want you to tell me if this is pointy, if it's sharp, or if it's dull and it's flat. Okay? We're going to go along his extremities on the dermatomes. And what does this tell?
Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp.
Okay, we're going to go along his extremities now. Just keep your eyes closed.
Sorry. Dull. Sharp. Dull. 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 Sharp. 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 Sharp.
So that just tested his sensory nerves and that everything was intact and it was all within normal limits.
Go.
So I'm going to be testing the vibration in his DIP and in his big toe. So I'm just going to put this on your finger. Let me know when it stops vibrating.
Okay, stop.
Perfect. Let's do it over here.
Okay.
All right. I'm going to do the same thing down here. When you stop feeling it, just let me know.
Okay.
Perfect.
Good.
Perfect. That was completely negative. So now we're going to perform some special tests. So I just want you to close your eyes. And I'm going to put this in your hand and I want you to tell me what is in your hand. Close it.
That's key.
Perfect. So that was stereognosis and it was negative. Now another special test that we'll be doing is point localization. So I'm just going to ask you to close your eyes. And where am I touching you? Perfect. Where am I touching you? That was negative. For the next part of our neuro exam, we're going to perform 2 special tests. They're going to be the Brudzinski sign and the Koenig sign, both of which are going to test for meningitis. So Michael, we're just going to start off with a sign. I'm just going to lift your head up a little bit. Now, this is going to test for meningitis due to the fact that if I tilt his head up, his knee should raise up as well. That would be positive. So I'm just going to lift up a little bit. All right, so this was a negative Brudzinski sign. And for Koenig sign, we're going to move on down to his lower extremity. I'm just going to bend his knee up a little bit. All right. Michael, so I'm going to raise up your knee a little bit and just tell me if you feel any pain, all right?
Okay.
All right, any pain?
No pain.
Perfect. This was a negative Koenig sign. So now we're going to move on to our musculoskeletal system. We've already inspected his gait, back and neurological system. Now we're going to assess and inspect his muscle tone. So can you do me a favor? Can you stand up for me? Thank you. We're just going to inspect his upper extremities, like the shoulder, the elbow, the wrist, and the hands. Everything looks symmetrical. Can you just turn around for me, please? Right there. Perfect. So we can see that very symmetrical posterior of his shoulder. Alrighty. And then we're also going to inspect his lower extremities. However, due to privacy concerns, we're not going to be doing that. We would be inspecting the same way: hip, knee, ankle, and foot. We would also check for his pelvic tilt. We're looking for any erythema, any edema, deformities. Let's also inspect the spine a little bit. Can you just turn around for me? So one more time, over here. Thank you. Like we said, it was midline, and we're going to move on to palpation as well. So we're going to palpate the spinous processes. We're going to go down, follow it down. Michael, just let me know if you feel any tenderness, all right? All right. So we would do this all the way until we get down to the sacrum, and then also going to be palpating the paravertebral muscles. Let me know if you feel any tenderness, all right, Michael? No tenderness, right?
No tenderness.
Perfect. All right. So now we're also going to be palpating, just one more thing. We're going to be palpating the spine as well. We're going to percuss the spine. I apologize. So we're just going to let me know, again, any discomfort or tenderness.
So first I'm going to start the assessment by doing
We would also do this in the paravertebral spaces. Perfect. So no tenderness, erythema, edema. Our patient seems to be in appropriate shoulder height. All right, so now we're just also going to continue during our palpation. We would palpate. Can you just stand up for me? I'm sorry. Just face me. We're going to palpate the shoulders. Any pain? All right. Elbow, pain here. All right. Anything here? Perfect. And hands are fine, right?
Mm-hmm.
All right. Beautiful. As we palpated the upper extremities, we didn't feel any crepitus, and they were appropriately warm. We're also going to, can you just sit down for me, please? All right, just let me know if you feel any pain. Pain?
No.
All right. Pain?
No.
All right. And any pain down here? Pain? Tenderness? Alrighty. Nothing, right? Perfect. So his lower extremities as well, warmth was present, no tenderness or crepitus. Of course, as we mentioned before, our patient would be in more appropriate clothing. However, due to the restraints, we won't be doing it. So now we're going to assess our patient's range of motion. Can you just stand up for me, please? Just face, I want you to face me, okay? So I want you to follow what I'm doing, okay? We're going to go straight up like this. Perfect. Straight back. Beautiful. Like this. This is a reduction, right? And then cross in the front like this. Beautiful. We're going to do the same thing, and I want you to do it against resistance, right? So I want you to go up, back, go out, and come back in. Perfect. And do this for me. And I want you to in the back, reach back back as far as possible. Perfect. And now I want you to hold your arms up like this and down. Perfect. Our hands, we're going to be doing, I want you to flex them going like this, up. And I want you to like this out and in. Perfect. Can you just put your fingers on this table right here? And I'm sorry, can you just turn it? Perfect. Just put your hands out here. I want you to squeeze as hard as possible, right? And spread them as hard as possible. Perfect. So I'll be doing our wrist. So I want you to bring your wrist down like this, and up, and out, and in. Now I just want you to do the number 4 with both hands. Perfect. All right, so we asked our patient to lay down on our table, and we're just gonna test the muscle tone. Just make sure that his active, passive, and against resistance is intact, like the testing for the muscle strength. So Tim, I'm just gonna ask you, can you just lift your leg up on your own? Perfect. Can you do it on your left leg now? Thank you. And I'm gonna ask you to move it to the side, your right one first. Thank you. And inside. Perfect. I want you to do that on your left leg as well. Perfect. That's abduction. And then once again, internal, your leg up. Thank you. And I want you to bring it down. I'm gonna ask you to abduct it to the right. Thank you. And bring it in. Perfect. We're gonna do the same thing on this one. Bring it out. And in. Perfect. I'm gonna ask you to bring it down. Thank you. And try to push up. Thank you. All right. As much as possible, putting your foot on the table, just like that, and cross your leg in like that. All right, on your own. Go ahead. And outward, same thing. Perfect. Let's do the same thing on the other leg. Come bring this one down. Yep. And inward. Perfect. Let's hit eye. Just want to ask you to move out your knee. Perfect. Thank you. And in. Thank you. Same thing on the other side. Let's do in first. And out. Perfect. 2+ strength on all his lower extremities. Right. So I'm just going to ask you to move this leg back. Perfect. And push it forward against resistance. And backwards once again. Thank you. Can we switch sides? Alrighty, so we're going to do the same over here. Just put his leg back on your own and bring it forward against resistance and backwards once again against resistance, and that was normal. Perfect. Alright, just gonna swing my leg over here. Alright, I want you to lock your knee all the way forward. Perfect, and all the way back. And bring it back normal and push up against my hand and back. Same thing on this side, forward and back. And push against my leg, my arm, and back. And for the last part, we're gonna just test his ankles and his toes. I just want you to move your foot all the way up. I want you to dorsiflect, point them down, your ankle all the way down. I want you to bring that toe all the way up. Perfect. And you're gonna flex your big toe down on the floor like this. Perfect. Thank you so much. So all of his, all the range of motions of his musculoskeletal system have been normal. Of course, except the neck pain, which we assessed earlier. Muscles were all 5+, and yeah, we can continue with the level of care that we would always provide as PAs.
Go for it.
So now, Tim, I just want you to follow my head. I want you to tilt it to your left, to your right. I want you to look to your left, look to your right. Look all the way up to the sky and down to the floor. Perfect. So our patient Tim had a complaint of neck pain, so we're going to be doing the passive motion on that as well. So I'm going to put resistance on your head, and I want you to I want to test how strong your muscles are, okay? So look to your left, look to your right. I want you to tilt to your left and tilt to your right. All right, I want you to look all the way up and all the way down. So muscle strength is 5+, and we'll continue assessing our patient for more of the complaints during our visit. So we're also going to be doing active range of motion with his lumbar spine. So if you mind, just touch down to your toes. Perfect. And just all the way back. Perfect. And I want you to go to the side like this on both sides, all right? Perfect. And we're also going to rotate to the right.
Left.
And to the left. Perfect. All right. No pain or any tenderness doing those actions. Perfect. So our patient had a complaint about neck pain, so we're going to be doing some passive motions just to make sure that there's no, I guess, not deformity, but like any tension in the muscle. So I'm just going to move your head. I want you to be like a dead weight. You can move it as much as possible. Tell me if there's any pain when I'm moving it, okay? Any pain, Michael? No pain. Perfect.
I have pain.
Okay, so now that our patient has pain with his head going down, we can have a better understanding of which muscles are involved, and we can continue his plan.